Hello and welcome to another Pre-Chiro podcast episode. I'm your host, Dr. Ben Glass, and today we're making a professional chiropractor connection down in Southern California with Dr. Aimee. Aimee, can you get us started by just introducing yourself and reflecting on that moment when you decided to choose chiropractic?
Yes, Dr. Amy Vandershelden at Mama's Chiro in Huntington Beach. And we focus on prenatal, postnatal, and pediatrics in our practice. The reason why I got into chiropractic was because I ended up shadowing a chiropractor while I was in college. And he invited me into his office, and I really loved how he had an interaction with every single one of his patients. He was like, "Hey, so how was your cousin's soccer game?" And I really loved how he had this, relationship with them. It wasn't, in my perspective, more like, "Hey, here's your prescription, and here you go. I'll see you later." By the way, what was your name? At least that's what I had gathered based on the other interviews that I had done with other practitioners in the fields that I was interested in. And then as I got closer to graduation in college, he then expressed to me that I can actually focus in prenatal, postnatal, and pediatrics, and while in chiropractic school. And I just thought that was really fascinating. And I was like, "How? I get adjusted, but babies, really? Pregnant moms?" And he's like, "Yeah." And so I think as soon as I opened up that avenue, and as soon as I asked that question, more pregnant moms and more babies started to come into his practice. I think it's just the energy that you put out is the energy you get back. And then that's when I started to really see that big impact and changes that happens within a mother and a child receiving chiropractic care. And I fell in love with it. And so I enrolled to chiropractic school at Southern California University of Health Sciences because it was closest to where I was already located, more for that than anything. And yeah, as soon as I started chiropractic school, I looked at the ICPA, and I believe I started the courses while I was in my fourth trimester. So as soon as I
We're gonna
got
get
in,
there. We're gonna get there. I just want to
oh, sorry.
rewind a little bit to like
Yeah.
your upbringing and like how you even were positioned to like be thinking about chiropractic. Like, what type of project were you doing where you were shadowing different doctors, maybe eye doctor or PA, or you were in a hospital? Like, what was going on in your life? Were you in college at the time? Were you changing careers? What was going on that
Yeah.
had you even consider to go check out chiropractic? How'd you even start to think about it?
Yeah. So, um, the reason why I even went into looking at the chiropractic profession is because I was going to a chiropractor while in college to get my back adjusted. My mom introduced me to chiropractic when I was in high school because I was complaining about my back, and I played basketball, I did soccer, I did cross country, so I was a very active teenager. And my mom heard that chiropractic can help, and so she took me to a chiropractor. And so in college, again, still very active, was running every day, and I was weightlifting. And so there was a chiropractor literally right at, like, down the street from the college that I was going to. And uh, and then I started just to asking questions about his profession and what he was doing, and what is chiropractic, more so in depth than what I was experiencing in high school. And so that is the only reason why I even thought, hey, maybe chiropractic would be a good avenue for me, or a good field for me to look more into. In college, I was studying biomedical pre-med. I was a biomedical pre-med student. And so again, like I mentioned, I was looking more into the medical route. And so the counselor at the time advised me to shadow and really interview doctors in the fields of interest, of my interest. So that's what I ended up doing. I went to Loma Linda Hospital, and I asked if I can come in and observe. I went to the local dentist that was close by. The only reason why I was looking into dentistry is because my boyfriend at the time was interested in dentistry. So I was like, maybe. But no, not for me. Um, Not that there's anything wrong with that. It's just that
Sure.
my calling was more towards chiropractic.
I'm just curious when you started to really feel deep down that this was going to be the path that you chose, that you were going to go to chiropractic school. How much time elapsed between that decision and you graduating college? And I'm also curious if there was any presence at all of pre-chiropractic or pre-chiro, or was your guidance counselor talking about chiropractic when you decided this? Did you get any pushback from any of your peers or family members or friends? Like, what was that whole experience like leading up to chiropractic school?
Yeah.
Was it smooth? Was it, yeah, if you could go into that.
Yeah. So, uh, yeah. So my parents thought I was going the medical route, as I mentioned already, and so what made that decision for me was an interaction in the office, and it was a mother who was pregnant, and she explained how when she first came in she can barely get up from the couch, and she usually likes to work out, and she usually likes to hang out with her other kiddo, and now she's pregnant for the second time. And she said that was a big difference between pregnancy number one and pregnancy number two, where she, number one, she did not receive any care, and then number two, she did. And so the reason she went in is because of low back pain. And after a few sessions, she says she's actually able to sit down on the floor with her toddler and play with them. And I mean, hormones, right? But at the time, she started to cry. And I was like, okay, what's the big deal? You couldn't, and now you can. And then it was like, no, this is life changing. Like, it means so much to my kid, and it means so much to, as she was expressing, that for me to be able to play with my kid. And that was like, okay, I want that. I want to be able to provide that to someone and make that big life change for someone like her. In that situation, in that practice that I was shadowing, I got to see that, and I got to hear that, and I wanted that for myself. And so I think that was my pivotal moment. And it wasn't until I was last year, it was in my junior year, basically like the last trimester, where I had to make a decision of like, where am I gonna apply? Because leading up to, I started to interview in my sophomore year, and it wasn't until junior year, end of trimester, where I was like, okay, like, this is it. I have to go for this route. So when I told my parents, they're like, what? Mihai, you're too little. There's no way you can adjust like big hunky men, and like, look at you, you're petite, you're tiny, you're short. And I was like, so I'll figure it out. I don't know how, but again, like, all the patience that I expressed to my parents, like that not everybody's huge when they go in and get adjusted. And I'm sure that the training that I was going to get in school, or even outside of school, was going to gear me up and prepare me for those patients that maybe are a little bit bigger, or maybe are a little bit more challenging as far as like cases maybe. And they're like, well, whatever you want to do. And then, yeah, of course, my friends were like, chiropractic, can you even make a living after that? Isn't that just, you just crack your bones and then that's it? Like, are you sure you want to do that? And I was like, yeah. And I tried explaining them my experience with when I was shadowing this chiropractor, and how much it made an impact, and they just didn't get it. Maybe because they didn't have that experience that I did, and at the time, obviously, I couldn't explain it as thoroughly. That enough to convince them, like, oh, okay, I see where you're coming from. And so, yeah, I did get some pushbacks from my parents, from my family, from friends who were just like, you're a girl, and you're small, and you're petite, like all of these things, right? But I stayed the course.
I was gonna say, just to speak to that young girl who might be in that position that you were in at that moment, if you could like maybe just send a message, either from a position of like being their unofficial guidance counselor, or from a position of just being somebody who's maybe a mentor that just wants to support them. Like, I guess, what message would you share to those that either think they're too small or are not really feeling confident enough to face their family or their friends in this huge
Yeah.
life decision?
So for those young, smaller, petite women, you could do this. There is definitely a lot of training that you have to do. Force equals mass times velocity. So if you don't have the mass on you, then you have to work on your speed. Get the training, not just in school, but also outside of school. That was, I feel like I learned so much in school, but then if you allow yourself to expand even further, because everybody has a different touch, everybody has a different technique, and the way that your male 6 foot, I don't know, 185-pound man adjusts versus a 5'2", 120-pound girl, it's definitely very different. I'm sorry to say it, but it really is. And then also too, you can not only just change your technique, but you can also use tools such as like a drop technique. And so all of these things you can actually learn in school as well as outside of school by observing and shadowing other chiropractors, going into their practices and seeing what is it that works for them. I'm right now 32 weeks pregnant, and so my adjusting definitely does change when I'm pregnant versus when I'm not pregnant, and even postnatally as well. Everything is still, loose out there. But you change, and as you start to gain more strength and as you start to gain your speed back up because of pregnancy and hormones, then you have to then change that technique as far as like what your body can provide for your patient, because at the end of the day you do have to be very careful with your body. Like I said, focus on prenatal, postnatal, and pediatrics. So my pregnant moms that are, bigger size, or that I can't really manipulate in a sideline position. Not that we should be sidelining every single pregnant woman out there, especially when they're in their third trimester. But you do a drop technique on their pelvis, and the ICPA honestly was very, very helpful to me, because that was I think it was like 120 hours additional to training in school that really like helped me out. As far as when you are pregnant, that's a whole different question. That I'm sure we can have a whole different other conversation
I
about
think
that.
I
But
think it's super
for this purpose,
important to, yeah, I think it's super important to acknowledge that as a woman you may become pregnant, and if you're a female chiropractor practicing, you may practice through your first and second trimester, and maybe even a good portion of your third trimester before you take time to yourself to prepare.
yeah.
I'm just curious, like if you could reflect on these last 6 to 7 months that you've been pregnant, or however long it's been. How has that experience been being in practice? How have you modified your time spent in practice, or the activities that you spend on the practice, or just taking time for yourself, right? That work-life balance, if you could maybe speak to that in the meantime too.
Yeah, so to answer your question, this is my third pregnancy, third baby. Yes, I do have experience in this field of being pregnant, owning my own practice, and going on maternity leave, coming back. So I actually got a personal message on my Instagram, and for those of you who are not following, please follow so you can maybe even get some guidance as to how you can also get out in the media and get out to the public and tell everybody how important chiropractic is. And so you guys can go on there, take my videos, use them as guides for you guys to start to educate the public. It's Mama's Chiro. You can find me on Instagram. However, to answer that question, like I said, an aspiring student actually reached out and asked me these questions. She said, "Hey, I'm a chiropractic student. My concern is that at one point I want to become pregnant. How did you do it? You're doing it right now. Is this something that maybe I should consider and maybe not going to chiropractic school?" And I was like, whoa, yeah, let's pause. Please do not choose not to go to chiropractic school because you want a family. In other words, you still go for it. If this is your true calling, if this is your true passion, if this is something that you know in your gut that this is something that you are going to do for the rest of your life and you're going to enjoy it, go for it. And even if you do become pregnant and you do want to become pregnant, And I think that especially in my field, my specialty, you're going to be able to relate to your patients a lot more. Even if you don't end up being pregnant or anything, that's okay. But it shouldn't stop you from going to chiropractic school. Number one, you do have to listen to your body, stay very active. Just because you're pregnant does not mean you eat like, you know what I SHI, you know what I mean, right? You still eat very healthy. You live what you live what you preach. And so basically, make sure you're getting adjusted. Make sure you're getting your massages. Make sure you're getting your body work. Move, eat well. And with that being said, I am, like I said, 32 weeks pregnant with my third baby. I'm planning to go up to 36 weeks. So I usually only take 1 month off for me to zone in and mentally prepare, physically, emotionally, get myself much more ready for that state. I know some may have some complications prior to what I am doing. Please listen to your body. I do know that there are some chiropractors that choose to go up to the day that they are due. I highly do not recommend that because of what I've experienced. Literally, my first pregnancy, I only gave myself 10 days before I was due, and that was a big no-no experience that I didn't repeat for the second, and I don't want to repeat it the third time. The reason why that ended up happening for me was because I couldn't find an associate to come and cover my type of practice. So when you do focus on a certain type of practice, you are a niche, and therefore there's not a whole lot of chiropractors that do exactly what you do. So if you look up prenatal chiropractor in Orange County, I will likely be the first one to come up because there's not that many of us out there, to be very honest. And I really have people coming from Bakersfield or like Arizona, Coachella, India, like out there. There's like hours. Not that I advise that. But anyway, what I was trying to say is that I couldn't find an associate. My mistake is that I didn't put the ad up long enough. So I was like, I'll put it up in 3 months. And that was a big mistake. Again, like I said, because there are not that many doctors that are, what I'm looking for is a Webster certified chiropractor and someone who really wants to focus on prenatal and postnatal pediatrics. So if that is the practice that you want, then the amount of chiropractors that are out there does lower it down for you if you have that type of practice. At least from what I've experienced. My husband has a practice himself, and his practice is Huntington Beach Chiropractic. Associates, boom, 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 boom. Like every week, there were like 2 or 5 were applying because it was more of a general chiropractor. When it came to my practice, and I put the ad, it was like 1 to maybe every 1 to 2 months, and that was it. And so, number one, make sure you put your ad up as soon as you know you're pregnant. I'm just gonna say it. Just give yourself enough time to find someone. Number two, I wanted to have enough time to train this doctor that was going to be in my practice to be comfortable around my demographics, but also our patients to be comfortable with her. When it comes to pregnancy, and babies, they need more nurturing, they need more guidance. You're going to be okay. You don't necessarily only need Dr. Aimee. You need movement in your life. You need movement in your joints. You need that muscle, ligament, work on your body. And it doesn't necessarily only have to be Dr. Aimee or Dr. Blah. It can also be your associate. So they need that nurturing, that familiar face every single time that they come into your practice, and you reassure your patients like, you're going to be okay. Trust me. And I'm only going to be gone for a little bit, and it's a lot of that. And I feel like I sorry to say this out loud, but if my husband were to take paternity leave, right, and I don't think it would be that much of like hand holding. It's going to be okay as compared to specifically the demographics that I work with. So please go for it. It's worth it. I love it.
I think that you touch on a really interesting point, which is that we don't have a ton of pregnancy, pediatric, prenatal chiropractors out in the world. I mean, as far as opportunity goes, looking at like a career outlook, how would you maybe contextualize the path? Obviously, you touched on the ICPA being a great training program, but like, what types of topics do you study? What types of videos are, what types of information are you making videos on your channel? Obviously, that's going to be a great resource for any students that are watching this, but I'm just curious if you were to like bring a short, concise summary of the path that you've taken to a high school or college student or a career changer, how would you describe becoming the type of specialized chiropractor that you've become?
Um, so again, you have to first figure out what is your passion. Don't just go and do pediatrics because you think babies are cute. Like, yeah, babies are cute. Go into it because you want to serve them, because you want to care for them, because you want to see improvement in them, because you something inside draws you. And then if you get a difficult case, you know that you care so much about it that you're going to take that extra time at night to look it up or to look at other resources that maybe you are not that familiar with yet. And so with that being said, yes, the ICPA courses were very helpful for me to give me the confidence, give me the information, and give me the hands-on practice. Dr. Stephanie Libs is a great information source out there as well for breastfeeding, lip tie, tongue tie. So I didn't just do courses through the ICPA. I also did business courses, to be honest with you, because in school, they don't really teach you the business behind it. I know this is going a little bit off topic, but it helped me go outside of school and ICPA to learn more about the business and how to maintain my business because you have to stay open. And so I did.
Go into that just for a moment because there are Cairo students that are going to be watching this, and I think it's really valuable to not think that the people watching this video that it wouldn't necessarily be that relevant to them. It's definitely relevant to any chiropractic student to hear from you that you did go and take business courses in addition to the ICPA because I think that's a great message.
Okay. Um, so aside from the ICPA, I also did business courses where I learned how to manage my practice, how to obtain patients. And funny story, actually, before I get there, Mama's Chiro actually started as a mobile practice, and it was by Dr. Jen. I wish her name right now escapes me. And she did an online training to teach me the business of doing a mobile chiropractic practice. And so Mama's Chiro actually started as a mobile chiropractor. So I was a chiropractor with her table, going to midwives, going to doulas. And I got so busy that at the moment I needed to have an actual shop. And because I had made all those connections with doulas, birth workers, midwives, lactation consultants, massage therapists, they're like, tell me what you need. Like, I will help you. Like, do you need some funding? Do you need, like, I'll help you with your first month's rent if you let me come in, like, actually teach a course here and there. And I was like, really? Cool. All right. And then anyway, my first business training was actually through her, and I got to learn about relationships and maintaining relationships and practices. And so those were really, really important. And then I did do more hands-on training with not a financial counselor, with oh my God, Dr. Prescott. And she was teaching me more in-depth pillars about tones of people who are coming into your practice and more about how to encourage a patient to choose you and also to pay you. So that was really instrumental. And then I also did, what is it called? Call Jam. And sometimes I do courses there. Man, I should have written all of them down because I did so many. Cash practice, that was another one. So anyway, bottom line, don't just do courses for the specific like demographics that you're looking for, but also look at business courses because I don't feel like our school gives us enough of that. And again, like I mentioned, even with just technique, is the same concept when it comes to your practice and maintaining that business. So the more that you learn from each one course, you're going to pick not one single one is going to give you everything that's going to resonate for you and how you want to practice, and that is not the only one way that you can do it. You can grab from here, you can grab from there, you can grab from here, and then make it your own. As of next year, I will be 10 years in practice, and I really think that not there was not one single course that I ever did was like, I am doing that A through C and this is what it works. I, like I said, picked out on every single one of them. And yes, it was time consuming, and yes, some of them were boring, and yes, some of them were very expensive, but it is totally worth it.
That's a great advice. Can you maybe just speak to that student who just entered student clinic? They're in their last year of school. Obviously, you just mentioned that you started a mobile practice, but what are some recommendations besides taking some business courses of maybe how to choose where they're going to practice, or whether they should think if they're going to enter into an associateship, like what's worked well in your experience in recent years of like the people that you do bring into your practice? How do those relationships become symbiotic where both people are benefiting, not just one person, and you're able to give people that value, that the experience is very valuable to them?
So for those students who are on their last trimester and you've learned the business behind it and you have the funds to, maybe even start your own practice, don't let fear get you in the way. I was advised by the big top chiropractors that I should not open my practice. I am young, I am small, I don't know what I'm doing. Very encouraging words there, right? That I should learn the business and observe and shadow a doctor first. And so I did. I went and I thought that the chiropractor that I needed to shadow had the business down, because that's what the other chiropractors around me were telling me. And I was like, well, everybody advises me that I shouldn't have my practice, but I knew that I wanted to have my practice. So I was like, well, I guess this is the first step that I'm supposed to take. But if you don't know if that is the first step that you're supposed to take and people are advising you, then maybe that is the route. But I knew for sure that I was going to have my own practice. That was it. So anyway, I took that first step, and it was not the type of practice that I wanted and the type of model that I wanted to live. I learned a lot about insurance and great chiropractor, great adjusting skills, very, very high volume. So I got my speed down. And however, I quickly learned that it was not feeding me, and I was not being compensated, unfortunately, to the potential that I could essentially reach. And so I was online searching, and I had an epiphany moment where I was like, I cannot continue to do this. Like, I cannot keep $20 an hour is nothing. When we're seeing like 10, 15 patients in 1 hour. So it was very 5-minute adjustments. That was it. And it was not the pediatrics, and it was not prenatal. It was very everybody and insurance. And so I started searching, and that's where I came across the mobile practice. And so I started to build up my mobile practice that way. Again, I know that this is a whole different route than most people do. But if you are going to go out and you have it in you and you have ambitions, don't let fear get in your way. If I would have started all over, I would have probably just not done the whole associate thing and just gone for it. But I think what the steps that led me to the moment that I'm not at now is because of the mobile practice. It forced me to really get out into the community and make those interactions. If I would have had a pop-in shop, I think for me, or like an actual building and an office, it would have put that pressure on me to be able to make rent. So if you are going to be an associate, make sure you're an associate for the practice that you want to practice. Meaning, if you want to practice in prenatal, postnatal pediatrics, do not go to a malpractice insurance office. Do not go to a workers' comp office. Go to a prenatal, postnatal pediatric chiropractic office. If you want to do insurance, don't go to all cash practice. Go to one where you're going to learn what you want to learn and then say, thank you. I love you. Now I'm going to go and do my practice. If you want to be an associate, and make sure that you read through your contract and make sure that your chiropractor is compensating you well. The associates that I've had, I definitely have gotten guidance. I've gotten my lawyers involved because I want to make sure that everybody is happy. And when I say happy, means that whatever defines their happiness. So I asked them, what is your ideal scene? What do you want to work? How long do you want to work? How many patients do you want to see? How much money do you want to be making? Not a lot of people ask these questions. They just say, hey, you're going to do this is how much you're getting paid. I asked my associates, like, what is your ideal scene? Let's get you as close to that is. And if it's unreasonable for the moment in time, then let's figure out how we're going to get you there. So someone comes in and say, hey, I want to get paid $150 an hour, and I only want to see 5 patients. Sorry, that's not going to work for me. So I say, hey, listen, this is my contract. This is what it looks like. Does that work for you? And then they may say, well, I want a little bit more money for hourly rate. I love it. Why? Because that tells me that person has ambition. That person wants more. And then if depending on how much they're asking, I would say, okay, but maybe we're not going to give you so much in bonus. But if you don't get that much in bonus, then that drive in you is not going to be as intense because now you're just getting paid hourly. You can just clock in and clock out, and that's it. Your passion and your drive is going to diminish based on studies and statistics that I can really show. You want to keep motivated. So in my practice, we do have hourly rates. We do have a bonus for how many patients you see, and then we have a monthly bonus. So if you're seeing more patients and you're keeping your patients, then you get compensated for that. And then I obviously do pay for vacation as well. So really look at your contract.
Amazing. If we could just speak present moment, you having 2 children, 1 on the way, your husband also practices chiropractic. What's that dynamic like of having your practice, your personal life, being in practice, or maybe not being in practice with your husband, but also just being a chiropractic couple? What can you kind of just speak to that a little bit?
Yeah, so we have a really unique office because it is my business and his business, his office, and we're connected by a hall. So we do work the same days and almost the same hours, but we're not like butt to butt right next to each other. He has his side and I have my side. And when parents come into my office, as an example, and it's mom and dad and baby, mom and dad are coming into chiropractic, and then dad starts to go like, like, can you adjust me? I'm like, nope. You go down the hall, get adjusted by my husband. And he's like, what? Your husband's a chiropractor? Like, oh yeah, I get adjusted by him all the time. Oh, okay. So how do I do that? Literally just walk him down the hall and there is my husband's practice. He adjusts me, and I'm sure like if you start to follow both of us, we have a couple of videos that actually I believe have gone viral because they get to see our interaction and how we love to work out, we love to get adjusted, and we're just goofy, I guess.
Amazing. Can you
But
speak? You just mentioned the viral thing. Oh, well, yeah, no, if there's a but, by all means, let me let you finish. I'm sorry.
what? I think I lost my thought on there.
All right.
But my parents were like hesitant about and actually my in-laws were hesitant about us practicing together. But we're not really practicing together. Like I said, we're not like butt to butt, like adjusting because we have 2 different units. And so far it's worked wonderfully for our practice because of even just that one example that I just gave you where dads want to come in and get adjusted. I don't want to adjust men. I want my practice to be only focused on prenatal, postnatal practice because that is what moms have expressed to me. They say, I love the fact that I don't see you adjusting men, or not that that's an issue really. It's just that they love that it's just only women and kids. So I wanted to keep it that way, and so it's easy just to say, hey, just go over there.
No, that's fascinating. The keeping it really simple and specific. Can you maybe just speak to the viral video concept? Like, what makes a video, I guess, gain traction, or how have you gained traction online? Maybe speak a little bit about the workflow, like what your team is, just for that, because that in itself is almost like a separate business
Yeah.
within the business. Just having gotten more serious about it more recently of how to capture experiences and not be all up in people's face, but do it in a way where you're able to remain connected to that person and honor them, and not turn it into a show, but have it be more of just like, hey, we'll capture a little bit of this just so you can see what we do here, but we're not going to continually be asking people, hey, can we put a camera right by your neck or anything like that.
Yeah, so I have three different types of videos, I guess I could say. One is where I'm just speaking, so it's just me, and I give you tips and advice as to far like what like top three things that you can do during pregnancy to help you with round ligament, and I'll go through the motions or whatever. The second type of video is when I have a patient and I'm adjusting them. So I always ask them for permission. In our intake forms, we have in there a clause, would you allow us to film you and put it on our social media platform? So we ask permission ahead of time, and then we still ask them again if we're allowed to, if we can record them during their adjustment, and then tell them in advance, hey, I'll be asking you a few questions as I'm going through. These are the questions that I'm going to ask you, just to kind of prompt them. And so that they don't get nervous either, right? And it's conversational. It's like, hey, and just capturing the moment of the adjustment. And I'll ask them, so remind me again, why is it that you decided to come into chiropractic? How did you find us? And then she'll say, blah, 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 because I was having headaches. This is the latest one. Okay. And how has your life been impacted since then, since coming in and getting adjusted? And she mentioned, well, I've been headache free for 2 months. Boom. That is huge. Imagine a mom that's at home stuck under a blanket with the lights turned off and their kids downstairs. Someone has to take care of them. But because she has a headache, she is under the covers in her bedroom with the lights off. That makes a huge difference on that mom, especially if she's scrolling and she's saying, oh my God, like that's me. I can totally relate to that. So you want to capture those moments as much as possible and as genuinely as possible. You don't want to really sit them next to them and be like, so tell me, how is chiropractic really helpful for you? It becomes kind of like too prompty, I guess. And you just go with the flow, make it easy, make it fun. People want to see fun. My handle is a little different than my husband's and my brother-in-law's. Theirs is more pap wow and adjustments, and they're a lot about that, and they definitely have a lot more followers. Mine is getting that momentum, but I was hesitant, honestly, to show that adjustments, because again, when I was first starting in school, I was, do not show an adjustment, do not do this because it can be misconstrued. But I think as you build up your likeliness and social media, people are going to start to trust and like you, and that's what's going to gain you that momentum to be like, okay, what she's doing is actually correct. But you do have those like pop loud type of uh, videos that do end up going viral. A lot of the ones that have gone viral from my side, it's more of like a cute little baby making like googly gaggly noises, and like us adjusting, and then you show by looking like having someone make sure that they're capturing their reactions and their sounds. So we do have good lighting and we do have mics to capture those moments, and then hearing the parents respond to, oh yeah, they were coming in with colic, they were spitting up all the time, they're fussy, and now sleeps through the night, pooping every day, no more spit ups, holding down their milk. Like, you want to capture that as well. It doesn't have to be like a, hey, here's a camera, I'm going to interview them. Make it fun and flowy. Then that's what's going to help your videos.
Mhm. I'm curious if you could just share any sort of bigger picture ideas, visions that you have. You've achieved success in practice. You have some presence online now. Do you have any kind of ideas that you want to share that like has come to you as you've evolved in practice and gained this sort of expanded idea of what kind of impact that you could have worldwide? through the internet or just through your practice. I'm just curious where you're at with the future, with the next 10 to 20 years, because me and you are in the practice the same amount of time. And I'm just curious where you're at with how you peer out into the next 10 to 20 years.
Yeah, excellent question. I have a bucket list of things that I want to get done, and I keep having these babies. I'm just kidding. No, in all seriousness, I always get asked, where do I get those pillows that you use, or where can I get that pillow? And then I tell them where I got them, and they're like, "Oh my God, that was so expensive." Like, yeah, because they're designed only for chiropractors. So that's my one thing that I want to make sure that I do. I want to design my own pillows that I use for babies to be comfortable laying in there. But that not necessarily only chiropractors can purchase, and not necessarily. I want the mom to be able to afford them and put their baby in there, because lots of they're like, "Oh my God, that's the only place that my baby will actually lay tummy time. What is it about your that pillow?" And I was like, "Oh, it's the way that they designed it." But there are certain the material itself is I want to redesign it so that it can be used for everybody. So that's project number one. Project number two, I've been advised and not coerced, I shouldn't say that word. I've been advised and really strongly advised that I should become a franchise. And because I do have a lot of people reaching out, hey, do you know anybody in New York? Do you know anybody in Texas? Do you know anybody? And so if I were to make some sort of, I don't know, credentialing or course where I can get other people alongside the same idea and concept and philosophies that Mama Caro holds, then I can franchise. But for attorneys, they're like, just maybe wait until your kids are old enough so that you can see if your kids are going to be trouble. Because if they are, then you might not want to franchise because they might be too much to handle. So, anyways, it's in the works of that, and I am in the works of doing a prenatal exercise course and a recovery course, because I really truly do believe that postnatal care is there's not enough of it. There really is not enough of it postnatally, and also too for dads. Like, where do you get that guidance of how to support a woman or how to support your partner through that postpartum phase? And did you actually know that men can actually, like, partners, their significant others can go through postpartum depression too? It was crazy. I didn't
I
know
mean,
that. I was like, really? But
I
makes sense.
I've definitely seen a lot of friends of mine as they have a kid, their belly it tends to get a little bigger as mama's belly is getting bigger. And when we had our kid, I also practice with my partner here. We're both chiropractors in Oakland, California, Northern California. But
Awesome.
when we had our kid, I I wouldn't say that we were experiencing the same types of lifestyle challenges, shall we say, but I definitely agree. I think even making it partner based, where the husband and the wife were both parents are working and supporting each other, and just sort of deconstructing and demystifying that dynamic of like, how do I
Mm-hmm.
not piss them off by saying that I'm going to work out, or how do I invite them, or whatever, however it
Yeah,
needs to happen. But anyway, as we
totally.
wrap up this conversation, I just want to say thank you so much for taking the time to share with any students, current or prospective students out there. Just the final message from you of anybody on the fence. Maybe they want to go to chiropractic school, maybe they don't. Maybe they know they want to go to chiropractic school. Maybe just any final messages from you.
Yeah, if you are a high school student or even a college student and you're thinking, questioning, is chiropractic something that I want to do? Shadow someone that has someone that is going to really give you an idea of what chiropractic is. Ask them if they can, if you can go in and just check them out for like half the day, just so you can get a feel for that. Remember too, there are different types of chiropractors and there's different types of techniques out there. So just because you go to one that's maybe activator doesn't necessarily mean that that's the only way that chiropractors work. There are different techniques, and you'll learn that more in chiropractic school. Um, but try to shadow as many people. Try to shadow as many chiropractors as you possibly can, so you can get a feel of the different types of techniques, different types of environments, and different types of chiropractors that are out there. I would say go to I think people are allowed to go to LifeWest, right? And check out the seminars that are out there. If you're interested, go to these seminars. Go to oh my God, what is it called? Is it called LifeWest? The seminar out there?
The Wave was this past
Wave.
weekend.
Yes, go to the Wave. Go to these platforms like Pre-Chiro that will teach you and talk to you about chiropractic more in depth. And so look for accounts like Pre-Chiro that will help you and guide you towards that. If it is truly that you want to, just you'll feel it. You will feel it and listen to that gut.